Do you have shooting electrical pain traveling down the back of your leg? Does the pain get significantly worse when you sit in a car or on a hard chair? Have you had an MRI of your lower back and the doctor told you the scan looks mostly normal or only shows a minor disc bulge, yet your leg is in pure agony? If you checked these boxes, you might be a victim of a massive medical misdiagnosis. You probably do not have a spinal injury. You likely have Piriformis Syndrome. A deep muscle in your pelvis is actively strangling your sciatic nerve, and treating your spine will do absolutely nothing to fix it. To understand this misdiagnosis, you must trace the anatomy of the sciatic nerve. Think of this nerve as a long water hose. The hose connects to the water faucet at your lower back. It then travels down through your pelvis, specifically underneath a thick muscle called the piriformis, and continues all the way down your leg. True sciatica happens when a herniated disc clamps down on the hose right at the faucet. But fake sciatica happens when the faucet is perfectly fine, but someone is stepping on the hose out in the yard. In Piriformis Syndrome, that muscle in your buttock spasms, swells, and physically crushes the nerve cable as it passes through the pelvis. The leg pain feels exactly the same, but the location of the damage is completely different. This anatomical trap leads to a catastrophic danger: unnecessary spine surgery. As humans age, almost everyone develops small, painless disc bulges in their lower back. If you go to a surgeon complaining of leg pain, they will look at your lower back MRI, see that tiny, harmless disc bulge, and blame it for your pain. They will perform a microdiscectomy to cut away the disc. You will endure the pain, the risks, and the cost of spinal surgery. But when you wake up, the electrical fire in your leg will still be there. Why? Because the surgeon fixed the bulging disc, but the heavy muscle is still crushing the sciatic nerve down in the leg. You cannot find Piriformis Syndrome by only looking at a standard lumbar spine MRI. The standard spine scan usually stops right above the exact area where the muscle traps the nerve. To find the mechanical truth, a doctor must act like a detective. We must perform a highly specific physical examination, checking if rotating your hip triggers the electrical shock. Furthermore, we must expand the imaging to include a dedicated MRI of the pelvis and the sciatic notch, looking for muscle hypertrophy, anatomical variations, or localized inflammation wrapping around the nerve trunk. Because the pinch is in a different location, the solution is entirely different. We use a strict two-step protocol. Step 1, confirm the target. We use a highly precise ultrasound-guided diagnostic injection directly into the piriformis muscle. If the leg pain vanishes instantly, we have proven the diagnosis. Step 2, decompress the nerve. We do not touch your spine. We use targeted physical therapy, specialized muscle relaxants, or in severe chronic cases, a minimally invasive endoscopic release to carefully cut the tight muscle band and free the trapped nerve cable forever. If you've been diagnosed with sciatica and someone is recommending open spine surgery, you must pause. You must verify the exact location of the compression before you let a scalpel near your spine. Stop guessing. Let our expert neurosurgeons review your imaging. Click the link in the description to upload your MRI to our secure portal. Let us evaluate your spine and your pelvis, give you a definitive second opinion, and ensure you do not undergo the wrong surgery for the right pain.